So, good afternoon, students. Today we will discuss about the nasogastric and orogastric tube insertion, or also known as your NGT and OGT. So, this is one of the parts or the essential skills that a clerk, interns, as well as a doctor is required in the hospital setting. So your NGT and OGT are used for therapeutic purposes, especially in cases wherein you have to administer enteral feedings for medications, especially those pulverized medications, and then you have to dilute it in water or dissolve it in water, and especially for gastric decompression in cases wherein patients has um, small bowel obstruction or large bowel obstructions. Okay, so these are some of the purposes or therapeutic purposes of your OGT and NGT. Okay, so this is the overview of our discussion for today, your NGT and OGT insertion. So this is a helpful infographic. This is actually an AI generated infographic, which is very helpful for guidance. Okay, so let's proceed. So, what are the indications and contraindications for your NGT and OGT insertion? For the indications, number one is again for bowel decompression and GI obstruction. Because of the GI obstruction, there is no passage of the food and materials in your GI tract, because of, especially in cases wherein a patient has strictures or masses within the GI tract. So we use NGT or OGT in order to decompress your gastrointestinal tract. Okay, secondly, aspiration of gastric fluid content from recent toxic material ingestion. Take note of the term recent toxic material ingestion. So that is an acute setting of cases. Okay, we use this for especially in cases we have to do lavage. Okay, next, disorders of oral feeding, such as for patients who are cachectic or those who are unable to swallow. Okay, they have difficulty or dysphagia, difficulty in swallowing, so we use NGT and OGT for nutritional support or feeding administration, to increase the nutrient or metabolic requirement, and for medication administration. Thirdly, for UGIB or upper gastrointestinal tract, upper gastrointestinal bleeding evaluation. And lastly, for administration of radiographic contrast to GI tract. Okay, so next, what are the contraindications for your NGT and OGT? Number one is your craniofacial trauma. So, or your severe maxillofacial or mid-face trauma, because again, we have to avoid the insertion of NGT to the other parts of the body aside from the GI tract. Because if you have craniofacial trauma or maxillofacial trauma, you would be possibly inserting the tube into the brain, into the spinal cord, because of the trauma or because of the fractures in the facial area, and also your basilar skull fracture. Next, the problems with the GI function, like for example, if the patient had a perforation of the GI tract, you have esophageal varices, very common cases, acid alkaline ingestion, and esophageal obstruction. So there's this case wherein in a specific hospital in Davao City, clerk was asked to do NGT and OGT. However, since that clerk did not know the case of the patient, that the patient had esophageal varices, upon inserting the tube had bloody output, and thus the patient had shock, because the patient had an upper gastrointestinal bleeding due to the trauma to the esophageal varices. So it is very important to take note that those patients who had perforation, esophageal varices, and with acid alkali ingestion, you don't have, or it is best to avoid inserting OGT and NGT. So it is very important for you to take note before inserting a specific tube to the patient to know the case of your patient. Okay? And lastly, those patients with coagulation abnormality. Because again, if the patient had coagulation abnormality, the patient is prone to bleeding upon um, upon trauma to the different varices or to the GI tract perforations. Okay, so those are the very important indications and contraindications of your NGT and OGT insertion. So, what are the materials needed? Of course, you have to choose the appropriate tube for your patient. French 10 to 18 in adult, 12 to 18 in adult also for the NGT and OGT. Okay, you have to measure the tube. We will learn later in the procedure how to measure the length of the tube. Very important. Thirdly, you have your lubricant, your lubricating jelly, pH testing strips. These are important in the confirmation of the location of your tube. 10 ml syringe, or actually what we use in the hospital setting is asepto syringe. Okay, the asepto syringe, this is very important in order for us to confirm the placement of your tube in the GI tract, especially in the stomach. You have to use your stethoscope to hear for the gurgling sounds for the confirmation of the placement. Water, very important, sterile water. Tape for the securement of the device. Important are your gloves. As much as possible, you use sterile gloves and your mask, towel or tissue. This is very important in order for you to clean the lubricating jelly in the nose of the patient. Marker, we don't usually use this unless we label the parts or areas. And those are the important materials that we need for the NGT and OGT insertion. Okay, now let's go to the procedure. So basically, the NGT and OGT are quite different only in the area where you insert the tube. The NGT, from the word nasogastric, you have to insert it in the nasal area in the nose, while the orogastric, you insert it in the oral area. So the nasogastric tube is usually inserted to adult patients, while in the neonates, especially in preterm babies, we use orogastric tube. Okay, so very important, number one, before your anything else, you do hand hygiene and assemble your equipment. Very important that before you start the procedure, your equipment or materials are already placed beside or at the bedside of the patient. Secondly, you have to explain the procedure to the patient. Number one, what are the indications for these patients? Like, for example, the patient had dysphagia, you have to tell them, ma'am, sir, you have difficulty in swallowing, especially in cases wherein you have a CVA or stroke patient. They have weak gag reflex. So you have to insert nasogastric tube for feeding, because if the patient had CVA or stroke, and if the patient's gag reflex is actually weak, they are very prone to aspiration. So you have to insert NGT for this patient. Very important also, after explaining the indication for the procedure, you have to position the patient. Fowler's position or in sitting position is very important, or it is also helpful for you to insert properly the tube if the patient's position is correct. But however, there are patients wherein you have to insert NGT in patients who are GCS3 or in coma, for those patients who are at the ICU. So you cannot position the patient properly unless you have the help together with the nurses. So proper positioning would actually help you to correctly insert your tube. And then after that, you lubricate your tube by using the lubricant that is placed on the left side of your hand with the gloves. You lubricate it generously, and then after that, um, make sure that you have already measured the length or the appropriate length of your tube. So the appropriate length is actually from the nose to the ears to the X or your xiphoid. This is the next. The nose or nasogastric area, the ears, and the X, your xiphoid. So that is the appropriate length. And you take note in the numbers that is written in your tube. So especially in the adult size, there are numbers that you can see in the tube. So usually the numbers that I have practiced in the adult patients, it is usually from 50 to 60. It differs lang kung gaano kataas yung xiphoid area niya or sa GI tract ng patient. And then after that, you gently insert the lubricated tube into the nose of the patient. And then after that, you advance along the floor of the nasal passage. While continue advancing, you ask the patient to swallow. Okay, this is one of the most important parts of the procedure. While gently inserting your tube into the nose of the patient and towards the nasal passage, you have to ask the patient to swallow. So, ingnan mo, pagsulod nimo sa inyong tube, you ask the patient, ma'am sir, tulon lang, sige tulon. While the patient is swallowing, you continue advancing your tube. Now, if there is obstruction while advancing, you try to look at the mouth of the patient if nag-coil ang tube. It is very important that you also look at the mouth of the patient. You ask the patient to open his or her mouth to check for the coiling of the tube. Kasi minsan, if there is obstruction, there is really coiling inside the mouth of the patient. So, when there is obstruction, check for the mouth. If there is no obstruction and continuous lang siya, until you reach the mark of the area na na-measure ninyo kanina, you stop. And then after that, before securing the tube at the nose of the area of the patient, you check for the correct placement. Okay, for checking the correct placement, we will learn it later. Okay, so these are the very important steps in your NGT and OGT insertion for patients who have problems in GI tract or the gag reflex or any indications that the NGT or OGT may be needed. Okay, so how do we select the appropriate size and approximate the length of insertion? So these are the NGT sizes based on the age or weight of the patient, especially in pediatric patients. Okay, you have French 8, 10, 10 and 12, and 12. And for the different age and weight of the pediatric patient. Or you can use this formula, okay? Patient's age plus 16 divided by 2. So that is the appropriate NGT French size for these patients, especially in pediatric patients. Okay, now let's go to your NEMU versus next procedure. So when you say NEMU, this is nose, ears, and the mid umbilical area, MU. Okay, so this is after the xiphoid process. This is below the xiphoid process. While the next is your nose, ears, and the xiphoid process. So according to studies, NEMU methods, or those tubes that goes beyond the xiphoid process, demonstrated superior accuracy, that is 97.2 versus the 59% of the next method for placement in the stomach. Upon closer evaluation of the next method, they often resulted in higher esophageal NGT misplacement, increasing the risk for aspiration and jeopardizing the patient's safety. So also in my case, as I practice this NGT insertion, I usually measure the length of the NGT insertion beyond the xiphoid process or the NEMU procedure, because you have to at least reach the stomach or the gastric area for you to secure assure the proper placement of your tube. Okay, so what are the things that we have to check after inserting the tube? You have to confirm your placement. Okay, you can use aspiration of the gastric contents by using the syringe or the aseptic syringe, and you test the pH. If the pH is 5.5 or below, then you are sure that the placement of the tube is correct. Second, this is the most commonly practiced by the physicians is the auscultation for air insufflation. So when you have a tube, you open the tube that has already been inserted, and you try to insert the aseptic syringe, and then after that make sure that your stethoscope is in your ears. You hear or you place your diaphragm of your um, what do you call this, stethoscope at the gastric area or the stomach area, and then you try to push your aseptic syringe and then insufflate with air, and you try to hear for the gargling sounds in your stomach. If there's gargling sounds upon insufflation of the air, then it is proper that you say that the tube is already correctly placed. Okay, and then after that you secure your tube in the area. Okay, so those are the important uh, confirmation of the placement of the NGT. And however, the gold standard for this is your X-ray. However, for what you call this practicality, we don't usually order X-ray after in NGT insertion. Auscultation for insufflation is already okay for the confirmation of the placement. Okay. So basically, those are the very important things that you have to learn on your NGT insertion. So please watch this video first.
Hi, my name's Adam. I'm a medical student. Can I take your name?
Hi there, it's Lewis Potter.
And what's your date of birth, Lewis?
It's the 5th of the 9th, 1988.
Okay. At the moment, you're unable to swallow food safely. Because of this, I'm going to insert a fine tube through your nose and into your stomach. It might be a little bit uncomfortable, but it shouldn't be too painful. If it does get too uncomfortable, let me know and we can stop. Are you okay for me to go ahead with the procedure?
Yes, that sounds fine.
Okay, this is very important. In this procedure, this part of the procedure, this is your, what was noted here is your necks, your nose, ears, and the sternum or xiphoid process. However, we use NEMU. You take note of the length. However, upon measuring, you have to take note that you don't touch the tube to the skin of the
I'm going to put
patient
the tube
because
in
it
now.
is sterile.
It's going to be a bit uncomfortable. If you could take small sips of water while I'm advancing the tube and tap me on the arm if it gets too uncomfortable.
You insert the tube. While advancing, you have to tell the patient to swallow. Yes, if you meet any obstruction, you check for the mouth for any coiling. And then, what's kulang here is that before you secure the tube, you take note the proper placement, okay? The insufflation of the air, and if this is correct, you check for, okay, baliktad lang sa kanila. They secured it before testing for the pH test. However, in common setting in our hospital, we just use the auscultation method.
I've now finished the procedure. The tube will get a bit more comfortable over the next few hours. To complete the procedure, I would order a chest x-ray to confirm the position of the tube if I was unable to aspirate gastric contents.
Okay, so those are the very important things you have to learn for OGT and NGT insertion. So we're done with the procedure. Thank you so much for listening. We'll see you next week for our skills laboratory. Okay, thank you so much.